This is the Morning Blend Out Live with Heather and Alex.
All right, welcome back. There is something new in Tucson, something to be very proud of, happy about, and frankly comforted by.
That's right. It is Tucson ER and Hospital, and its technology and its medical team is incredible. And we are joined by the people behind it and leading it. Dr. Sean Murphy, the Chief Medical Officer, is here, along with Dr. Darren Kay, the Chief Operating Officer. Gentlemen, so nice to have you here at the El Conquistador Resort. I know you just came off of a 24-hour shift, so we really appreciate that.
Absolutely.
I know this is your passion. You love helping people. So with that said, let's talk about Tucson ER and Hospital. People who aren't familiar with it, what would you say?
Well, so we're the only physician-owned hospital in Tucson, and the only place that you can go to the emergency room and be guaranteed to be seen by a board-certified, residency-trained emergency medicine physician.
Wow. And how do the capabilities compare? I mean, we think of a traditional ER in a hospital, you know, how does it compare to that?
We have MRI, ultrasound, CT, laboratory. We can provide every service that another ER can do.
Well, and so many times when we go in to see a physician, you're either referred to somebody else, or you have to wait a couple of weeks to have an MRI done or have a CAT scan done. So what are some of the other capabilities for people who would visit you?
Well, so yeah, that's a great point. Most of the time, the reason why we don't get all the diagnostics done in the emergency room setting is because there's just not enough time. Because we're herding patients through, for lack of a better word, like almost like cattle. I mean,
right?
Because that's the way we're.
I think a lot of people feel that way.
That's true, and that's really a shame, and that's what we're fighting back against. Is we want to be able to take the time to explain things thoroughly, and if we need to do an MRI on the spot. We can get it done, and
don't have to wait 3 hours in a room, and to get it done, it can get done immediately.
Yeah, or wait for a week till you can schedule it, or call the imaging center.
Whatever's convenient is the point. And so, is this model fairly new? Is this something that you see as the future of medicine?
It is new to Tucson. It's kind of going across the country. I think it's a very efficient way to provide emergency care. We're not trying to herd people through. We have time to talk to people, provide compassionate care.
So you may have been frustrated with a family member or something like that who's had to endure, the weeks, and maybe it's really urgent. You're nodding your head. So where did this model come from? Was it experience that you had, maybe with a patient or your family member that said, this has got to be changed, something has to be done?
Well, definitely, Darren and I can both attest to the fact that every place we've worked in recent times has part of the model has been that we need to see patients at an ever increasing volume in a shorter amount of time with fewer resources and fewer staff. That's just, unfortunately, that's the corporate model is to maximize efficiency, and if that comes at a cost of time and patient satisfaction, then it's just what it is.
It's got to be frustrating. I mean, here you are trying to take care of somebody, you never see it really come to fruition, so you don't get to have that personal relationship.
And that's, I think, really the secret to making healthcare more caring, right? With adding the I want to say love, because that's what it takes to care for someone and to help them heal, right?
It is love. It really is. It's a labor of love.
Yeah. And of course, when we're talking about healthcare workers like yourself, you just came off a 24-hour shift, you said, and you seem pretty happy. And so, this model is also good for the healthcare workers, in other words?
Oh, absolutely. Yeah. I mean, I think Darren and I both agree that never enjoyed practicing emergency medicine anywhere else more. And part of that is just that we're doctor administrated as well as we're the doctors that are practicing. So there's no one telling us what the best way to go about the care is.
It's got to be fulfilling for you then as a doctor. I hear people at home saying, really? This is really possible? I don't have to wait a week or, just to sit there and then get a referral and go through the entire process. And, because a lot of people would go out of the country even because it's under one roof in different places.
That I can attest to that as well. Yeah, especially with our proximity to the border. I just recently had a patient who sought specialized care across the border because of the efficiency and that it was going to happen in a more timely fashion.
Dr. K, why do you do this?
Well, I've been practicing for 21 years in Tucson, and it was just a refreshing thing that I could come, take time to treat patients, have say in the administrative as well as the medical side. It's been very refreshing.
Personally, what would you say to people at home who are wondering, really, is this really possible? Is this going to happen for me? What would you say to them?
Yeah, absolutely. We're open right now. We're open 24/7, 7 days a week. And like I said, every single doctor you see has a vested interest in not only giving you the best medicine, but also is really interested in your experience. And
absolutely, that's what it's all about. Yeah, get some sleep, please, and go relax, enjoy. Thank you guys so much for being here. Nice to meet you.
Thank you for having us.
Nice to see you. And guys, the new Tucson ER and Hospital is located at 4575 East Broadway Boulevard. If you want more info, check out TucsonERHospital.com or call 520-375-9111.